Next on Sisterhood of the Second Act.
When the vaccine for COVID was rolled out during the pandemic, its release put a spotlight on the level of distrust the African American community has with the United States government and the medical community. That distrust comes from a history of unethical treatment and experimentation. Today on Sisterhood of the Second Act, Lillie Head joins us to talk about the United States Public Health Service study on untreated syphilis in the Negro male. Head is the president of Voices for Our Father's Legacy Foundation, an organization that started in 2014 by the descendants of the 623 men involved in that study. What that study involved, its ramifications, and what's being done to prevent history from repeating itself when Ms. Head joins us a little bit later in the show. And how does a crisp blue sky make you feel? What about a yellow kitchen or that little black dress? The psychology of color is real. Beth Garrett joins us to explain how to use the psychology of color to impact how you feel and even how you are perceived by others. We'll meet both women on this edition of Sisterhood of the Second Act right after this.
Looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with the loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids said they'd be looking for a thorny tree from me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Now from the Fox Radio Roanoke studios, this is Sisterhood of the Second Act. Welcome to Sisterhood of the Second Act. I'm Denise Allen Membranio. Lillie Head has lived with the ramifications of the study of the United States Public Health Service study of untreated syphilis in the Negro male. Her father was one of 623 men involved in the study, which lasted 4 decades. Now her mission is one of education, correcting the narrative of the study and its participants. Lillie is the president of Voices for Our Father's Legacy Foundation, and she joins us today to talk more about the study and medical ethics and all of the ramifications it's had in that community and even throughout our country. Lillie, thank you so much for being here today.
Thank you, Denise, and it's a pleasure to be here. And I am excited to talk about Voices for Our Father's Legacy Foundation and how we are moving forward.
Well, let's start off with the study first, because some people may not be familiar with it. It has several names, for instance. So can you tell us about the study and the evolution of the naming?
The name of the study, when it started in 1932, in Tuskegee and Macon County, Alabama. The men were recruited or lured into the study by being promised that they would receive treatment for their bad blood. They were told that they would also receive a free meal when they went to be tested or to receive the so-called medical treatment. They were told they would receive, if they agreed to, a biopsy over upon their death, they would receive medical insurance. Understanding where the men lived, the poverty of the men in Jim Crow race, in Jim Crow South, the opportunity was quite interesting for the men, and they felt as though it was something that they could do to better their health. better their health. And they trusted the doctors who were giving them this information. So that was in 1932. Now, the name of the study at that time was the Tuskegee Study of Untreated Syphilis in the Negro Male. But as the study went through the 40 years, and after it was known, it became commonly known as Tuskegee Syphilis Study or the Tuskegee Experiment. That's confusing. And this is where the foundation and the descendants are trying to change the narrative of the study. It was known as Tuskegee Syphilis Study, or it is known as Tuskegee Syphilis Study or Tuskegee Experiment. And I would really ask your viewers to help to talk about how that's wrong. Because when you say Tuskegee Syphilis Study, you're placing Tuskegee as the owners, the people who are accountable for it, and people who are responsible for that study. And it shouldn't, and that should not be, it's the United States Public Health Service study of untreated syphilis in the Negro male. Also, when you say Tuskegee Experiment, you can confuse that quite easily with just talking about the Tuskegee Airman Experiment in Tuskegee. And the two are nowhere near connected or related.
Now, little history lesson, you mentioned bad blood, which at that time in the 30s included a number of ailments.
Absolutely. And then there's a reason for them knowing about that. It was started with Rosenwald, with the Rosenwald Foundation. And there was a close relationship between Rosenwald and Booker T during his time while he was living. So that relationship had started. But Rosenwald wanted to help poor people in the South, especially blacks in the South, with their health because they knew it was a lot of health problems. And so health program had started there in Tuskegee and Macon County as well as in other southern towns to do that. So that's how they had that background and inroads into getting it there.
Now, the ethics come in is because these men did not get treatment, correct?
No.
I mean, what did they, and they were not told what was going on?
No, not only that, the men were not told, they did not receive they did not give permission to be in a study. They did not know they were in a study, and they never were told for over 40 years that they had syphilis, not until after the program was exposed. Now, there are some men who could have or probably found out that definitely they had syphilis after they moved away. But then there are some who did not know, because when the men moved away, they were on a list where they were denied treatment even if they were away, if those doctors who were treating them. The men were also denied entrance into the military because they didn't want the military to know about the study and that the men were not being treated. Well, you mentioned ramifications as it is. It wasn't only ramifications for the men and their families. It was for the community, and it was actually for the country because of the unethical treatment and actually the immoral treatment of those men during that particular time. Imagine after penicillin was developed, the men were still denied the treatment.
We are talking with Lillie Head. She's the president of Voices for Our Father Legacy Foundation, and we're talking about the United States Health Service study of untreated syphilis in the Negro male. And other ramifications, I would think, if these men didn't know they had syphilis, they're out there spreading it too.
Those who had active syphilis, they were spreading it. Now, there were a lot of the men, in fact, many of the men who were in the syphilitic study were latent patients or latent syphilitic people. My father was one. he had congenital syphilis. And a lot of the men had congenital syphilis. Understanding also that syphilis was rampant in this country. It was like a pandemic, or it was a pandemic during this particular time. That's which makes it a little bit more egregious as to why you go to the least among us to not to serve them. So some of the families, even today, some of the grandchildren and the children still suffer from the effects that they actually inherited from their mother because of their father that were in the study. So that's good. And we have contacted most of them that, quote, most of them are died, but the ones that are living, we are in touch with them. And they receive care from the Public Health Service.
So the study ended in 1972. 25 years later, President Clinton apologized for it. What did that mean to descendants when he apologized for it?
It was a welcoming apology. It was also thought of as a little bit too late, and a little too little. But it also showed where there was some remorse. Although no accountability has ever been given to or received from the people who actually did it, the doctors who did it, no accountability for that. But it was welcoming because it was a chance to say I'm sorry on behalf of the government who had allowed this to happen for so long. The United States Public Health Service study of untreated syphilis is the longest lasting non-therapeutic study.
Wow, I did not know that.
Yes, in public health history, the longest. And it is not only still having ramifications, because we saw that with the COVID-19 pandemic and how the COVID-19 pandemic illuminated the inequalities and the racial inequalities and disparities in healthcare.
We're talking with Lillie Head. She's the president of Voices for Our Fathers Legacy Foundation. And we're talking about the United States Public Health Service study of untreated syphilis in the Negro male. Before we run out of time, I want you to talk about the foundation and what the positive mission that it's on.
Well, the foundation, it makes me smile because we have a group of descendants who organized the nonprofit organization in 2014. And so we haven't been around that long, but I think we have made gigantic steps forward in making a difference. And one of the things that really brought the foundation to the forefront and in the conversation surrounding inequalities and racial disparities in healthcare was the pandemic. And we were called upon because the study was used as a reason why many people thought they should not take the vaccine because they were afraid something would happen to them the way they thought happened to the men in Tuskegee, which was they thought the men were injected with the bacteria. They were not injected, but some people thought that. And some people thought that the injection would alter them in some type of way and make them sick. And the men didn't receive anything, so nothing altered them. The only thing that happened with that, they were not treated. So we were called upon to advocate for the vaccines and to encourage everyone, especially within the Black community, to consider seriously taking the vaccine because it was a good thing and it was life-saving.
And you also offer scholarships.
We have scholarships that we give annually to descendants, and encouraging our awardees to consider the medical field or the healthcare field. We also are planning to build a memorial and inspiration garden at Tuskegee from the apology that then President Clinton gave. There was a bioethics, it's called the National Center in Bioethics for Research in Healthcare. And at that center, we are planning to build a memorial and inspiration garden, a garden of reflection, a garden of healing, and a garden that honors the men's contributions to research and the medical world.
Ms. Head, we thank you so much for being with us today.
It has been a pleasure, and I appreciate the opportunity.
And also, we will have the contact information for Voices of Our Fathers Legacy Foundation, and you can get in touch with Ms. Head through that website if you would like to have her come speak at your organization. And when we return, have you ever noticed that certain colors make you feel calm, happy, or depressed? There's a reason for that. It's called the psychology of color. That's what's coming up. We're going to tell you how to use that psychology to improve your life right after this.
Cabbie Fashions take you from the boardroom to the beach. Dress for a garden party or a night on the town. Independent cabbie stylist Darlene Marshall will make sure you look your best no matter what the occasion. She'll bring the store to your home for you and your friends or schedule a private consultation. Call Darlene 540-330-6819, 540-330-6819, or find her on Instagram at Dapper Darling, on Facebook at Darlene Marshall Independent Cabbie Stylist. Once again from the Fox Radio Roanoke Studios, Sisterhood of the Second Act.
Welcome back to Sisterhood of the Second Act. I'm Denise Allen Membreño. Have you noticed that wearing a color like yellow makes you feel upbeat and happy? Or how walking into a room painted in certain shades of greens and blues make you feel restful and calming? Well, you're being impacted by the psychology of color. Color is Beth Garrett's business. As owner of Elevating Your Image, she helps people look their best by performing a color analysis to determine what looks best on them. Beth joins us today to talk about the psychology of color and how to use it to improve our lives. And thank you so much, Beth, for being with us today.
Well, thank you for having me.
So, what is the psychology of color?
Oh, that's really a loaded question. So color has been used for centuries to represent something. And color is heavily used in marketing and in advertising. And so you can also translate that into using color to create the right image for us. The brain interprets colors to mean different things. And and you can't blame people for making the judgments because it's something the brain does you don't even realize. And so we associate the sun with being bright and being very cheerful. So, or something clean. So like in, Lemon Fresh Joy is in a yellow container. Restaurants, you'll rarely see a restaurant whose branding has been done in green because green kind of reminds you of getting sick or being expensive. So most like fast food places for kids are red, yellow, orange because it's bright, it's exciting, it attracts people. So you can use color to influence how others perceive you by wearing different colors. So would you like to hear what some of the associations are?
Yeah.
Okay, so if you are someone who's in a managerial or a position where you're over others, and you want to be perceived as being in charge and the buck stops with you, you're the man or you're the woman, then you need to be wearing a dark color because the brain interprets a dark color as very authoritative. It's formal, it's sophisticated, it's authoritative. Policemen's uniforms are in usually black or navy blue. That represents authority. I think I may have shared with you before, my son is autistic, and several years ago, I used to work in the hospital, and he came to the hospital one day. We were walking down the hall, and our vice president of human resources was coming down the hall, and Josh stopped and went, oh, look, it's the president. And it was our HR person, and he had a black suit on. So even, his brain interpreted that dark color as someone who was important. If you want people to perceive you as being like energetic and powerful and exciting, then wear the right shade of red. And men have the red power tie. Well, women's power tool is the red lipstick. I was actually reading research that indicates that you could be the most incompetent person in the world. You walk into a room with a red blazer and a red lipstick on, and everybody's going to perceive you as being very competent and in charge, because that's what that color projects. If you want people to perceive you as trustworthy and friendly, then wear your right shade of green. If you want people to perceive you as being like dependable and reliable and calm, then wear your right shade of blue. So there's all kinds of connotations behind, how you can project a certain image. This is especially helpful those who are in sales and who want to make a great first impression. Very rarely do you get a do-over when it comes to the first impression, and so you really want to project, the right image with how you're dressing.
Now, we are talking with Beth Garrett, owner of Elevating Your Image, about psychology of color. And you mentioned the dark power suit, and you work a lot with older people or people, over 45. And I've heard you say that black is not your friend when you reach a certain age. It can age you. So how do you incorporate that power suit or that power color if it's not going to make you look your best, if it's going to make you drag you down?
So the fashion industry has done a fabulous job in convincing us that everybody needs that little black dress or, a closet full of black because it's sexy, it's sophisticated, it's just the go-to color. But the reality is that some of us, like you and I, are warm-toned women, so black is not a good color for us. It will wash us out and make us, it will age us. So what we want to do is find another neutral that's in our season that gives us the effect that black would if we were a winter. So I would be looking for something like a dark taupey gray. It would be better for me than black. Also, dark colors, even if it's a good dark color for you, will cast shadows on the face, which is aging. And so if you're wanting to look more vibrant and more youthful and bring life to your face, then you need to be wearing a bright color that comes from your color season. And a lot of the ladies I work with now, like 55 and older, they're not so much looking for, garments for the workplace. They're now at a point in their lives, they're looking in the mirror and they're going, oh, I really don't like what I'm seeing. And I'm starting to age and it's kind of depressing. So you can use color to brighten your face and help give yourself a more youthful, dewy, glow about your face. And time and time again, nice. I know. So time and time again, when I'm draping my clients, it's those brighter colors in their color season that just gives their face life. And color is a mood changer. You can put on a really bright, pretty color, and it'll actually change your mood.
You're right. Not only the people who are looking at you, but yourself.
Exactly. And the one thing I think I have really learned by performing my services is that your appearance affects every aspect of your life. When you look in the mirror, it affects your feelings of confidence, it affects your feelings of attractiveness, it affects your feelings of self-worth. It could be affecting a relationship. It could be affecting your opportunities for employment or recognition. So, I guess I never really thought about that your appearance affects so many different aspects of your life, but it does.
You have a couple of stories about how color has impacted you in certain situations. Can you share those?
Sure. So I guess several months ago, I was invited to come speak for a library system in Smith County, Virginia. And I like to do this occasionally when I'm invited to come speak. I want to dress a certain way since the crowd doesn't know me. Or if I'm going somewhere where some people know me, I'll say, those of you who know me, I don't want to hear from you. So I was speaking, I hadn't even met the lady who hired me that day, and I wore a yellow jacket and a yellow pair of pants. And so what I was trying to project was cheerful and happy, that image, okay? So I walked in and I said, okay, you all don't know me, but you've already made judgments about me based on my appearance. So before we even start, I want you to describe to me what kind of person I am. And the first lady raised her hand and she said, I think you're a very energetic person. I'm like, okay, thank you. And the very second lady who raised her hand, she goes, well, I think you're probably a very cheerful person. And I was like, yeah, ding, 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 that is the answer I was looking for. So she actually said exactly what I thought, what I was trying to project. So the other situation I had shared with you was several years ago, I went on a job interview. It was I came from the IT world. And so I was interviewing in a place for IT director, and it was mainly going to be working with men. And so I went to this interview, and I've always known about my colors and what looked good on me, and there's this peachy pink suit that I have that I know that looks nice on me. So all I thought about that day when I went to the interview is I want to look nice. So I wore the suit, and it was like 8 men interviewing me, okay? And so I would be the boss over men. Well, I thought I nailed the interview. I thought it went well. I was so hopeful, and I never heard from them. And so later, when I started doing this, I finally realized when I went into that interview, I was wearing this pink suit that was projecting soft and feminine, okay, to a bunch of men. Okay, I should have been wearing a darker suit, or maybe with a red tank, some kind of power color that projected the image of being in charge and being, like the boss. So I don't know if that had anything to do with me not getting the job, but I'm sure it didn't help matters, me projecting that image when I went into that interview.
And then you can wear the pink suit once you get the job.
Yeah, exactly.
And show them how powerful you can be in that pink suit. So as we get ready to wrap up here, what should we think about when we're getting dressed or decorating our house as it refers to color?
Well, color is used in all kinds of different areas. I know if you want like a calming room, or you want peace and serenity, then blue is always a great color to do that. I know when I worked in the hospital or our behavioral health center, all the rooms were in light baby blue. And I was told that was because you don't want to paint rooms in a color that would agitate people, like red. So you'll always see calming colors in situations like that. It just depends on what kind of mood you're trying to create. So when it comes to color, what looks good on us, we want to wear colors that harmonize with our coloring. And that our coloring comes from the combination of your skin, your hair, and your eye color. And so those three things come together to give you an overall look of warm or cool. And then we start looking at if you're deep or light. And so there's different categories of colors that's going to best help your appearance look the way you want it to.
Very good. Thank you so much for enlightening us, giving us all the information about how color can change our lives.
This is your magic shopping tool. This is your color palette. So when I work with an individual, I will do a color analysis to determine what.
Is this your color analysis?
This is my color palette. I'm a spring.
Hold it up to your face.
So as you can see, these colors here, I'm matching up my green. What's really fascinating too is green is like one of the best colors you can wear around your face, because the greens and the blues in your season are opposite skin tone on the mental color wheel. So any color theory says if you find a color that's opposite on the color wheel, then that color will make it pop. So the greens are really good for skin tone. So if you're going to have a picture made or a headshot, your blues and greens in your season are some of the best colors you can wear.
All right, you heard it. Take it from Beth.
Absolutely.
Thank you so much.
My pleasure.
And we will have Beth's contact information on our website in our show notes at sisterhoodofthesecond-act.com. We'll be back to wrap up the show after this.
Looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with the loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
I would like to thank Lillie Head and Beth Garrett for being here today. Lillie educated us on medical ethics and the ramifications when those ethics are breached. Beth showed us that color impacts all aspects of our lives and how we can use color to advance our careers and improve how we feel about ourselves and where we live. I'm Denise Allen Membrano. We'll see you next time on another edition of Sisterhood of the Second Act.